What are the signs and symptoms of high blood pressure? Uncomplicated high blood pressure usually occurs without any symptom, and so hypertension has been labeled the silent killer. This because the disease can progress to finally develop any one or more of the several potentially fatal complications such as heart attacks or strokes. Uncomplicated hypertension may be present and remain unnoticed for many years or even decades. This happens because there are no symptoms and those affected fail to undergo periodic blood pressure screening. Some people with uncomplicated hypertension, however, may experience symptoms such as headache, dizziness, shortness of breath, and blurred vision, usually with blood pressure that is very high. The presence of symptoms can be a good thing. They can prompt people to consult a doctor for treatment and make them more compliant in taking their medications. Often, however, a person's first contact with a physician may be after significant damage to the body has occurred. In many cases, a person visits or is brought to the doctor or an emergency department with a heart attack, stroke, kidney failure, or impaired vision. Greater public awareness and frequent blood pressure screening may help to identify patients with undiagnosed high blood pressure before significant complications have developed. About 1 out of every 100, 1% people with hypertension with severe high blood pressure at their first visit to the doctor. In these patients, the diastolic blood pressure exceeds 140 millimeters mercury. Affected persons often experience severe headache, nausea, visual symptoms, dizziness, and sometimes kidney failure. Malignant hypertension is a medical emergency and requires urgent treatment to prevent a stroke. What are the different types of high blood pressure? In addition to the most common type of hypertension in which both systolic and diastolic pressures are elevated, there are three additional types of high blood pressure: isolated systolic high blood pressure, white coat high blood pressure, and borderline high blood pressure. Isolated systolic high blood pressure. Remember that the systolic blood pressure is the top number in the blood pressure reading and represents the pressure in the arteries as the heart contracts and pumps blood into the arteries. A systolic blood pressure that is persistently higher than 140 millimeters mercury is usually considered elevated. Isolated systolic hypertension is defined as a systolic pressure that is above 140 millimeters mercury, a diastolic pressure that is below 90. This disorder primarily affects older people and is characterized by an increased pulse pressure. The pulse pressure is the difference between the systolic and the diastolic blood pressures. An elevation of the systolic pressure without an elevation of the diastolic pressure, as in isolated systolic hypertension, therefore increases the pulse pressure. Stiffening of the arteries contributes to this widening of the pulse pressure. Once considered to be harmless, a high pulse pressure is now considered an important precursor or indicator of health problems and potential end organ damage. Isolated systolic hypertension is associated with a 2 or 4 times increased future risk of an enlarged heart, a heart attack, a stroke, and death from heart disease or a stroke. Clinical studies in patients with isolated systolic hypotension have indicated that a reduction in systolic blood pressure by at least 20 millimeters to a level below 160 millimeters mercury reduces these increased risks. White coat high blood pressure. A single elevated blood pressure reading in the doctor's office can be misleading because the elevation may be only temporary. It may be caused by a patient's anxiety related to the stress of the examination and fear that something will be wrong with his or her health. The initial visit to the physician's office is often the cause of an artificially high blood pressure that may disappear with repeated testing after rest and with follow-up visits and blood pressure checks. 1 out of 4 people that are thought to have mild hypertension actually may have normal blood pressure when they are outside the physician's office. An increase in blood pressure noted only in the doctor's office is called white coat hypotension. The name suggests that the physician's white coat induces the patient's anxiety and a brief increase in blood pressure. A diagnosis of white coat hypertension might imply that it is not a clinically important or dangerous finding. However, caution is warranted in assessing white coat hypertension. An elevated blood pressure brought on by the stress and anxiety of a visit to the doctor may not necessarily always be a harmless finding, since other stresses in a patient's life may also cause elevations in the blood pressure that are not ordinarily being measured. Monitoring blood pressure at home by blood pressure cuff or continuous monitoring equipment or at a pharmacy can help estimate the frequency and consistency of higher blood pressure readings. Additionally, conducting appropriate tests to search for any complications of hypertension can help evaluate the significance of variable blood pressure readings. Borderline high blood pressure. Borderline hypertension is defined as mildly elevated blood pressure higher than 140 over 90 millimeters mercury sometimes and lower than that at other times. As in the case of white coat hypertension, patients with borderline hypertension need to have their blood pressure on several occasions and their end organ damage assessed in order to establish whether their hypertension is significant. People with borderline hypertension may have a tendency as they get older to develop more sustained or higher elevations of blood pressure. They have a modestly increased risk of developing heart-related disease. Therefore, even if the hypertension does not appear to be significant initially, people with borderline hypertension should have continuing follow-up their blood pressure and monitoring for the complications of hypertension. During the follow-up of a patient with borderline hypertension, the blood pressure becomes persistently higher than 140 over 90 millimeters mercury and antihypertensive medication is usually started. Even if the diastolic pressure remains at a borderline level, treatment may be started in certain circumstances.